Hey everybody, it's the Phenomenal STEMist. I want to welcome today my Periscope people. This video might be a little bit too high. Sorry. There you go. We're talking about the neurobiology of trauma today. And unfortunately, my Periscope people can't see the video, but if you want to see the actual slides on what happens to adults as they go through traumatic experiences or they come from traumatic experiences in my childhood or their childhood, just join Phenomenal STEMist on Facebook. Good afternoon, good evening. My name is Dr. Maya Byfield, and I have a bachelor's degree in biology from Oakwood College, now University, and I did my master's and PhD in molecular pharmacology at Albert Einstein College of Medicine in New York City. Also, I did a postdoctoral fellowship in neuroscience at the University of Central Florida Medical School. So I'm not a psychiatrist. I am not a psychologist, but I know science pretty well. And so we're ending Mental Health Month talking about trauma. Last week, I discussed the role of childhood trauma in brain development. And this week, I'm going to talk about what happens to the adult nervous system when they go through trauma. Okay. So what you see is a slide about childhood trauma here. And you see basically 129 adults, 40% of them are female, average age 26 years old. They've been admitted to a psychiatric hospital at least 2 times. And so they did a survey on them, asking them what kind of traumatic experiences did they have in childhood. And some of it was emotional neglect, some of it was parental abuse, both nonverbal and verbal. You see peer physical abuse, sexual abuse, all kinds of levels, and 30 to 50% of them went through some kind of traumatic experience. Now, we're not saying that these traumatic experiences are the direct causes for their psychiatric visit, but there is a commonality that a lot of them had some kind of trauma in their childhood, and it ranges from ages 5 to 15, with the peak being around 12 years old. And so just bear with me a little bit. Let me move this screen here. So let's look at the nerve development. I kind of discussed it last time. The nervous system grows for about 40 weeks. It's the first system to grow in the human being. And look at a baby's brain, right? It grows and grows and grows. But look, after 9 months, there's a lot of neurons in that brain. We call it neuroplasticity. Lots of neurons growing. 2 years old, lots of neurons. So there's a lot of growth of nerve cells from the womb all the way up to 2 years old. And look at the adult brain, though. So you go from 2 years old to adult. There's actually more neurons in the child's brain than there is in an adult brain. Okay, so what happens is the babies and toddler and elementary child, their brain grows. That's the time when their brain is growing the most. But when they get to around late adolescence, actually the brain starts to prune itself. It starts to prune itself. So brain cells actually start to die. Brain cells actually start to die in adulthood. And what they do is they start to focus on each other. So before they were just growing, and now they have specific connections with each other, and all other cells that were there that are not heavily connected, they'll die. And so it's a very important time in a young adult's life when this pruning is happening. You don't want the pruning to happen too much, because you don't want too much brain cells to die, because then you'll start to mess with their cognition. But then you don't want it to not go through this pruning experience. So it's a balanced approach. And so we're going to learn what happens, knowing that, what happens to adults when they go through traumatic experiences. Okay, so let's look at the first slide. The first slide is showing two types of situations: post-traumatic stress disorder. I know you guys can't see, I can see it too. And depression. So the left side is post-traumatic stress disorder. These same people who had 2 visits to the psychiatric hospital, some of them had PTSD. And when they found out that some of them had PTSD, they asked them, okay, the people who had PTSD, what were the childhood traumatic experiences? And the heaviest amounts of traumatic experiences in the PTSD people were emotional neglect and physical neglect, high peaks. And the ages are like 10 years old when they remember it the most. So imagine having PTSD and remembering neglect in your childhood. So once again, emotional neglect and physical neglect, and sometimes sexual abuse, was heavy in adults with PTSD. People with depression, adults with depression, the highest amount of recollection of trauma happened with emotional neglect or sexual abuse. So adults who have emotional neglect in their childhood or sexual abuse in their childhood, it was those people had high levels of depression, and they remember it around 9 and 12 years old. Okay, and so what was the most important to them? So they're surveying these people who have had psychiatric visits. Some of them have PTSD, some of them have depression, and what they remember is that they were either sexually abused, emotionally neglected, or what mattered to them was the duration. People who were depressed, how long the sexual abuse happened or how long the emotional neglect happened affected them. Or also the combination of types of these traumas. So all of these things matter, right? So there are different types of adverse childhood experiences. There's emotional, physical, peer abuse, and then there's sexual abuse. So we're going to look and see what happens to the nervous system when people go through those abuses. Okay, so first thing, they're white matter, meaning the way the brain communicates with itself. If you remember last week, I told you that the brain has gray and white matter. So here's the brain. Here's one side of the brain. Here's another side of the brain. This side of the brain communicates with the other side of the brain. How? Through the corpus callosum, this big white matter here. Or white matter on the same side, association fibers, they communicate on the same side. Or they can send messages all the way down from the brain down to the spinal cord. So white matter is very, very important. And when they did a study on adults who've had severe parental verbal abuse, whether it's ridicule, humiliation, disdain, those white matter tracts were reduced. What does that mean? Well, if the white matter tracts are smaller, then the brain can't communicate with itself well. Right? There's no axons to send messages very well. So imagine going through your childhood where your mother or your father or the person who was taking care of you was constantly ridiculing you and humiliating you. That's verbal abuse. We're seeing that their brain couldn't communicate with itself. And these abnormalities will lead to emotional regulation, meaning part of your brain is supposed to communicate it with your emotional side of your brain. If it can't, well, then your emotional side of you will take over. Your emotional side of you will take over. You will have language difficulties, all kinds of cognitive difficulties. Why? Because the brain is supposed to take control and manage different parts of itself. How does it do that? Through white matter. But when those tracts are reduced in size, they, that can be an issue. So emotional regulation, handling, being able to say, calm down, relax, make good decisions, that's inhibited. Okay. Another area is the cerebral cortex, specifically the anterior cingulate cortex, the ACC. So what is this part of the brain? This is part of the brain is very much in charge of managing your errors. So it works with other parts of your brain to pay attention so that you don't make mistakes. And they found in adults that had traumatic experiences, smaller anterior cingulate gyruses, so smaller ACCs. Okay, so what does that mean? Well, if this part of your brain is very important for you to focus and not make errors, then if there's a problem, then you're going to make a lot of errors. It'll take longer for you to notice mistakes. At the same time, what they're seeing is now abused children make more errors, and then other parts of their brain ramp up to help to obsess over not making the error. If you follow me, so you make mistakes easily, but unfortunately, in abused children, when they make mistakes, they get beaten by their parents. So now they have to try to manage making mistakes or trying not to make mistakes. So they're overly emphasizing not making painful mistakes. So they get hypersensitive to punishment. They get heightened shames, or they get hypervigilance because, like, I can't make a mistake. They become perfectionists, right? Because of this issue. And what happens is they're seeing that children who have this abuse in their childhood, and this may be a cause, this may be, everything I'm showing you are maybes, okay? But it's comorbidity with depression and anxiety, because you're making mistakes, you have a slow error reaction rate, but you don't want to make any mistakes because you don't want to get abused. And so you're hypervigilant, and you become hypersensitive to punishment and heightened to shame. This is the same area that manages a child's emotions, or everybody's emotions. It manages everybody's emotion. So you don't want to go through any type of pain. So you're really hypervigilant. So that affects the child, but what happens to the adult? Well, then the adult becomes hypervigilant and very heightened to shame, and not want, they don't want to make any type of mistake. They do their best to avoid painful mistakes. This is what we're seeing in adults. How many of us go through that emotional kind of action where we're like, I don't want to make any errors. I don't want to make any mistakes. All right. That's another thing that's seen in adults that have gotten any childhood traumatic experiences. All right. We're staying with the limbic system, the emotions. Okay. Because the emotions are heavily monitored by the cerebrum. But if there's a disconnect, then emotions start to take over in children that have traumatic experiences. What happens in the hippocampus? So the hippocampus is an area that involves memory. I didn't talk about it much over here, but if you look, you see that this part of the brain is very important for social interaction. It communicates with the hippocampus. The hippocampus is heavily involved in learning and memory. And then that hippocampus will probably talk to the, your executive brain, like to make a decision about that. When you learn about a mistake, you make a decision not to make that mistake again. But what happens when there's a disconnect? And sometimes the emotion get involved. The amygdala starts to get involved. So you start to stress about what you remember, right? And so you start to be hyper vigilant about that pain. So hippocampus is heavily involved in learning and in memory. And what we're seeing in children who've had traumatic experiences, it's found to be smaller. So if you look at this picture here, this is a normal hippocampus size, and look at the size of someone who has PTSD. It's much smaller. And there are hypotheses in these papers that I've been reading, saying maybe the increase of cortisol. So if you remember last week, I taught you about what cortisol does. That's that stress hormone that's heightened in children, right, to handle stressful experiences, but it's like a prolonged type of hormone. It's not like you see a bear chasing you, you run and then you calm down, but this is a stressful environment for a long period of time. That's a different type of hormone involved. It's called cortisol. Well, they're saying that too much cortisol for a long period of time when you were a child could lead to death of the hippocampus. So low levels of memory. I just told you what hippocampus does. It's very important in learning and in memory. And so when the brain starts to die, you're going to have issues with remembering things, especially remembering things when it comes to associating learning. Yeah. So this is an adult PTSD. So what happened? So you went through a traumatic experience all throughout your childhood. You had heightened stress levels all throughout your childhood, too much cortisol, and it came to a point where it starts to damage your memory center. So issues with memories are affected in adults who've had traumatic experiences in childhood. All right, so another problem happens. Oh, I think something's going on with unfortunately, my Periscope paused a little bit, but yeah, so something else goes wrong in adults who've had traumatic experience. Hey, Patricia. Hey, Uncle Eddie. Thanks for joining. The caudate nucleus size. The caudate nucleus. If you look at the females, there's two types of subjects. Both of them have depression. And what they're seeing in males and females with depression, that depending on the score that they took this test, a quiz, and it basically like a survey, and it told us the high score, like whether you have low level depression or high levels of depression. So the higher the score, the higher the level of depression. And they saw that as the score went higher, the smaller the caudate nucleus was. So there's a part of the brain called the caudate nucleus. In males, it stays pretty much the same size. But in females, it shrinks when in females with depression, high levels of depression. So they connected it with emotional neglect, emotional and physical neglect. The higher the score, the more neglect, the smaller the caudate nucleus. So what is the caudate nucleus? What's the caudate nucleus? Okay, so the caudate nucleus is a part of the brain. Okay, so your brain is a big brain. It consists of 4 regions. The cerebrum, that's where you're getting all your sensory information. You see with your cerebrum. You don't see with your eyes. Your eyes take in the visual light and it transmits a message via nerves to the back of your cerebrum. And so you see with the back of your cerebrum. That's why when people damage the back of their brain, they go blind. Because they don't see with their eyes, they see with their cerebrum. They hear with their cerebrum. They touch with their cerebrum. So all the massive amounts of sensory information is coming in, and then the cerebrum integrates it or makes a decision about the sensory information. Well, can you imagine if every single sensory information that came in, your cerebrum monitored it? That's too much. That would be sensory overload. So there's a part of the brain, it's called the thalamus and the caudate, that literally makes a decision on what to emphasize on, what to ignore, and what to emphasize on. So all this sensory information is coming in. It's coming in your brain, and your brain cells are working with all the sensory information subconsciously. Right? So we're all, to be honest, we're all hearing voices. We're all hearing excessive things. Our brain is constantly doing things. Everybody. But we have a part of our brain that says that's not real. That doesn't make any sense. That's just practice. Some scientists say your brain actually practices all kinds of scenarios. So the synapses are creating all kinds of scenarios in your mind. But because you have the caudate nucleus, it basically says, that's not real, that doesn't matter. Focus on this. Well, if the caudate nucleus gets smaller, then that part is not working properly. We have a caudate nucleus to focus on our goals, to focus on the task at hand. So all other stimuli will be ignored. But when you don't have a functioning caudate nucleus, then you lose that task orientation and you lose drive. That's one side of it. So when the caudate nucleus is dysfunctioning when it's smaller and not working, then you lose your goal drivenness. You become apathetic. On the other hand, if the caudate nucleus is dysfunctioning, it's not working properly and doing all kinds of other things, then sometimes it will focus on things your brain will focus on things that don't need to be focused on. A classic example of schizophrenia is when people hear voices, right? Well, it's because, the theory is it's because that part of the brain does not shut it out, does not manage it well. Or sometimes it's overstimulated, meaning you're paying too much attention on the things that don't matter. So you're supposed to focus on things that only matter, but if everything begins to matter, because your caudate nucleus has been hyperactivated, you start getting hyperactive, obsessive compulsive. Everything starts to matter. You have to constantly focus on a whole bunch of things rather than on the goal at hand. But I want you to understand, a lot of times we judge people. We judge people based on what they're doing, and we don't even know what's going on inside. We don't know their history. I just told you that the caudate nucleus is literally smaller in females who have depression, that have a background in childhood traumatic experiences. All right. Let's go a little deeper in terms of something that you know of, dopamine. So dopamine is a very important neurotransmitter that works with the caudate nucleus. So most people think dopamine is it's the neurotransmitter that makes you feel good, because when you have sex, dopamine levels go high, you feel good. When you eat, dopamine levels go high, you feel good. The reason why dopamine levels go high is not for pleasure from good experiences, because you're starting to see other situations where it's a bad situation. Like if I punch you in your face, your dopamine levels will go high. Why? It's a bad thing. How do you gain pleasure from being punched in the face? Because it's not about pleasure. There's a role in pleasure. Why? It's a learning neurotransmitter. It says, whatever you just did, do it again. Do it again. It's great. But on the other side, whatever just happened to you, don't do that again. That's the role of dopamine. And what we're seeing here is that when children go through sexual abuse, look what happened. When they're exposed to sexual abuse, that's not a pleasurable thing. But look at their dopamine levels. High. When children have more than 2 family arrangements, when they're in unstable environments, unstable homes, look at their dopamine levels. High. Here's a picture of the caudate nucleus. When children go through early traumatic experience, when you give them amphetamine, so amphetamines are drugs that increase the dopamine levels in your brain. Why? Because sometimes, just like I said before with the caudate nucleus, when their caudate nucleus is not functioning properly, they can't focus. So some people give these people, like people with ADHD example, amphetamines to increase the dopamine levels in the brain so they can learn well. They can focus on something and learn really well. Learning causes dopamine levels to go high. Learning not to be in a physical or sexually abusive environment, right? Don't get away from that situation. That's why the dopamine levels are high. But look, when they don't have trauma, there's not much dopamine in the caudate nucleus, and this area that I've been talking about. There's high level. It goes up, but look how much more it goes up in children that had traumatic experiences. So there's now a hyper or overdrive of dopamine in that brain, more than what's supposed to be. Dopamine is supposed to go up to teach you to learn an experience. But when you have too much dopamine, then that same area that I just talked to you about, where you're supposed to focus and be goal-oriented, if there's too much dopamine in that area, then everything will start to matter. So you see this in people who take cocaine and certain types of drugs, right? These same drugs are stimulants. They increase the dopamine levels too high. So if you've ever seen people who have too much cocaine in their system, they become paranoid. Why? Because things that don't matter begin to matter. Everything that you see everywhere has a meaning to it, because the dopamine levels are high. And then unfortunately, when you stop taking those drugs, you go through this low experience. So a classic example, people who take marijuana, I know none of you, Uncle Eddie, Patricia, Shimi, none of y'all use drugs, right? But just, you've heard that when people smoke marijuana, they get the munchies when they're coming down. Why? Because they start to crave food. They crave it again because you're coming down. So you're craving something. You start to crave food. You start to crave things that make you happy. Addiction is defined as coming down from something and needing that same stimulus to get that feeling, to the point where people actually go through psychological withdrawals, right? They have to have high levels of dopamine in their system at all times, to the point where they feel actually sick, right? Because if you think the dopamine is helpful in your learning psychologically, then if you don't have that dopamine in your system, something is wrong with you, and you start to feel literally sick. So you've seen people who are being weaned off of drugs. They actually feel sick. Yeah, why? Because in their childhood, they were abused and they had a high, skyrocketing levels of dopamine. And then they're predisposed to any type of an addiction that causes that. So you can't even judge just drugs. Food does this, right? Sex does this. So anything that causes the hyperactivity of dopamine in the system, people will run to, even in the midst of their lives being destroyed. That's what that addiction is. But it started from somewhere. It started from traumatic, a lot of the times, traumatic childhood experiences. All right. So just to remind you this was a GIF. Unfortunately, it's not coming out as a GIF. Just to remind you how dopamine works. It's basically a neurotransmitter that it basically is in these vesicles, and then it leaves and binds to another neuron and sends a message. So what drugs do, what many of these amphetamines, cocaine, what they do is they constantly kick the dopamine out. They keep the dopamine out, and it's constantly in your brain, hyperactivity in your brain. So they say reward, like I said before, it's just motivation for learning. Learning, whether it be something pleasurable or something that has displeasurable happen to you that you want to learn from that situation. But it will lead to compulsion if there's too much of it. Okay? You see that in children that have gone through trauma. I mean, adults that have childhood traumatic experiences. Feel free to ask questions, guys. I'm almost done. What else? I see papers that involve antidepressants. So people who have depression, I told you the example of a person who has depression, their caudate nucleus is smaller, they have no motivation, they don't know how to have proper focus in their goals. And so then they're given antidepressants. So just to remind you how things work. So serotonin, for instance, serotonin monitors mood as well. How? It's also a neurotransmitter, right? It's a neurotransmitter just like dopamine. It leaves the neuron of one neuron and goes and communicates to another. So imagine this neuron on this side of the brain communicates with this side of the brain. Well, if the balance of these neurotransmitters, if they're out of whack, out of balance, that can lead to depression. So too much dopamine can lead to overstimulation, right? Imbalance of serotonin levels can lead to depression. So what they're saying is they give these antidepressants, these are drugs, to remove those imbalanced neurotransmitters. They're drugs that basically stop the dopamine from coming out in the synaptic cleft or the serotonin. And so when that goes away, then you get back to normal. Some drugs help to do that. But what they're seeing is with people who have no abuse in their life, they can give you antidepressants and you will respond. What does that mean? You won't be depressed anymore, and you'll also remit. You'll be able to stay for a while not depressed. But people who've had experiences in abuse, antidepressants basically is not working for them. Why? Because you can give them antidepressants for serotonin, but if something's wrong with the caudate nucleus, you understand? Something's deeper going on, and it's happening in our adults. And so they're depressed, and the medication that they're given for depression is not working based on their traumatic childhood experiences, many of them. Just to remind you, some of you guys just came in later, there are different types of traumatic childhood experiences. There's emotional neglect, there's physical neglect, there's sexual abuse, there's peer-to-peer abuse. And I told you before, peer-to-peer bullying is a traumatic experience that many people remember, but it's not found in people with depression, PTSD, and I forgot the other one. PTSD, depression, and anxiety. Even though many of them had bullying, it depends. It's emotional neglect from their mother. It's physical neglect from their mother. It's sexual abuse from whoever that actually starts to register in these children. It's having too many family experiences. We said that last week, orphans. Their brain changes. And then when they grow up, they're having all sorts of problems: depression, post-traumatic stress disorder, obsessive compulsion, perfectionism, hypervigilance, not trying to make mistakes. You see that in adults. All right. So once again, adverse childhood experiences it's still beyond the scope of science, but I hope I was able to, give you a few papers to show you what their thinking is happening. Not every child who's exposed to abuse in their childhood leads them to a mental health disorder. What I'm noticing is a lot of the papers show that they're survivors, so that if something is happening to them, they're trying to go off onto they're trying to survive, and it may shift them to the other side. So the key to surviving childhood experiences, I believe, that maybe the others that did not get a mental health disorder, is that they learned how to balance. That when things shifted in their brain, they didn't go off on the deep end, but many do. Many do, and it depends on how long the abuse was. If it was abuse for a long period of time, then there's more likelihood that there may be a shift in their brain development. So I always end with this, when you see people going off the deep end, when you see people having hypervigilance, they're perseverative, meaning they're constantly doing the same thing over, obsessive compulsive, they don't know how to handle their emotions really well, they can't manage their emotions really well, they're addicted to all kinds of things, not just drugs, anything that will heighten their dopamine levels. That can be food addiction, that can be sex addiction. They're prone to these types of behaviors. It could be that something happened to them. So don't stop. I guess we got to stop saying what's wrong with them. Instead, ask what happened to them. What happened to them? And I think we'll come away from judgment. We'll judge less. I know I'm judging people less. Just from me learning these things, I'm judging people a lot less, because a lot of stuff has happened to a lot of people in their childhood, and either their brain's not connecting well, or they're handling their emotions in a imbalanced type of way, or their dopamine levels are out of whack. They can't focus. Any of these things come from, sometimes come from adverse childhood experiences. All right, thank you guys. I really appreciate it. These are some of the papers that basically I found. So I want to honor the people who came up with this research. I also can be found on LinkedIn, Facebook, Instagram, Twitter, YouTube. Please subscribe to my YouTube page. I am the Phenomenal STEMist. Anybody has any questions? Any questions? Hey, Nate, thanks for joining. No questions. Let's see if there's any questions on my other side. My Periscope didn't work that well. No questions, guys? All right. Well, thank you guys for joining. Have a good night. Go Cavs.